Namaskar viewers, hello and welcome to Sansad TV. I am Teena Jha, you are watching Healthy India. India will soon be in a position to roll out the indigenously developed HPV against cervical cancer for girls in the age group of 9 to 14 under the National Immunisation Programme by mid-2023. This was announced recently by National Technical Advisory Group on Immunisation Chairperson Dr. N.K. Arora. Developed by the Serum Institute of India, the quadrivalent vaccine called Cervavac has received the DCGI's approval and also been cleared by the Government Advisory Panel, the National Technical Advisory Group on Immunization, for use in the public health program. It will be available at a much lower price, which is around 200 to 400 rupees. At present, the country is fully dependent on foreign manufacturers for the vaccine, which are priced somewhere between 3,000 to 4,000 rupees. So this move is being described as a major breakthrough as India accounts for about a quarter of all cervical cancer incidences and nearly a third of global cervical cancer deaths. Indian women face a 1.6% lifetime cumulative risk of developing cervical cancer and 1% cumulative death risk from cervical cancer. On the program today, we will analyze with experts how the indigenous vaccine will prove to be a game changer in ensuring more affordable drugs to Indian women, but also significantly improve the overall penetration, helping address the growing number of cervical cancer cases in the country. To take the discussion forward, I'm pleased to welcome on this edition of Healthy India, Dr. Manoj Sharma, Consultant Clinical Oncology, Delhi State Cancer Institute. Dr. Sharma, thank you for your time. Welcome to Sansad TV. And Dr. Kanika, Sylonia, Consultant Gynecologist and Obstetrician, RML Hospital. Dr. Kanika, thank you for your time. Welcome to the program as well. Let me begin the program today with you. You know, the numbers have really got me worried. I was going through the Lancet study report, which says 1 in every 5 cervical cancer cases, almost 1 in 4 deaths happen in India.
Exactly.
Help us and our viewers first understand what is really behind the galloping number of cervical cancer cases in the country.
Actually, there are many risk factors for the cervical cancer, and the main causative factor is the human papilloma virus infection. And that infection women will likely to get because of the poor genital hygiene, malnutrition, repeated pregnancies, and early marriage. And all these factors are very much common in India. That is why the Indians are, the cervical cancer is so common and the deaths are so common in India for women. And especially the women in India, they are neglected. From the last so many years, from the hundreds of years, they are neglected. This is a neglected population. That is why this is the main factor which we haven't controlled up till date. That is why it is the main causative factor for the deaths and all over the world, especially Indians.
You know, before we begin talking about the vaccination and what kind of difference is it going to make, help us also, understand, of course, you took us through the causes, but are the symptoms difficult to identify? Is it what is leading to late detection and perhaps?
No. Sometimes the symptoms can be difficult to identify, but generally because of the poor genital hygiene, generally females complains of discharge per vaginum, postcoital bleeding, irregular bleeding PV, but it is like I already said that the females are neglected in our country. That is why their symptoms are also neglected. Sometimes they used to neglect themselves, and sometimes by the family these symptoms are neglected. That is why they came late or they presented to us late.
Okay, Dr. Sharma, your thoughts on, of course, this aspect that women's health in our country is neglected, perhaps leading to several of these diseases, not just cervical cancer, and of which a lot of the victims are women in terms of the cases, the rising number of cases and also deaths, the larger number is women. How significant is the new move, the indigenously developed vaccine, which is now going to be available at an affordable price, going to make in the number of cervical cases in our country?
I will have a little reservation. Moving forward with Dr. Said just now, that's a very important thing, what she spoke. Before the vaccine came, we were always talking about the gynecological hygiene, gynecological health, hemoglobin level, nutritional level of the female, her upbringing. She has talked something very important about the number of children and pregnancies. You see, in China, they have brought down the incidence. They had a very high incidence. They have brought down the incidence to minimum because of the forced birth control. Same happened in Tamil Nadu and Kerala. because of education and because of awareness, their incidence was highest in India. They are now the lowest in India. So let us focus on that before we switch over to vaccine.
Sure.
Now with vaccine, there is something very interesting. You have talked about quadrivalent vaccine. But more importantly, what doctor has said has to be stressed upon, because these viruses are changing their varieties. We had monovalent vaccine, then bivalent vaccine, and then quadrivalent, and now there are nonavalent vaccines. Why? Because these viruses don't speak to each other. If you have vaccinated for type A virus, the type 2 virus will not be affected by type A virus vaccine. So therefore, in addition to the vaccination, we have to stress upon, doctor spoke in the very beginning on that factor also. You see, it will take some time for this vaccine message to spread all over the country and the availability of vaccine. So both things are there. In addition to that, I want to include one very important factor, and that is the example of Australia. Why vaccine females? Who is introducing infection in females? So in Australia, they started vaccinating the school boys also, and the incidence of penile wart, which is because of the papilloma virus, was very high, and suddenly they found by vaccinating the boys, the incidence has come down. So we have to mentally prepare that the vaccine is not for what we think is a, oh poor female, usko bachana hai. Vaccine has to be for both boys and girls, number one, because these are the boys. If you see the recent trends, the premarital adolescent sex incidence have simply shot up, and the cancer cervix to happen, it takes 20 to 25 years after the introduction of virus. So we have to be very optimistic. We should be better prepared instead of focusing on female alone and its vaccination, but we have to circumvent the victim, and I am not exaggerating, the culprit also.
Clearly, so that is something that I'm sure research would be underway, and we would hear that something of that kind is also available in the Indian markets. But the fact that for now, Dr. Kanika, we have our own indigenous developed vaccine, something that of course we are proud about, because it is going to it's going to be a game changer, at least in that age group where perhaps women are not even aware about the hygiene that you just spoke about, and also the fact that this vaccination assures them that perhaps they may not suffer what their predecessors or their ancestors have because of lack of medicine, lack of drugs. The important thing being that India is the pharmacy of the world, but if we have cases of cervical cancer which are among the highest in Asia, the third highest or the fourth largest number of deaths in the country, it does not speak well in that sense also. So we have to contain it. It's good news that it is going to be part of the public immunization program. What kind of difference will that make, especially in the adolescence age group?
Especially this HPV vaccination is mainly for the 9 to 14 years of age group, and it has to be included in the immunization program, so that as sir said, that it should be given to the boys also.
Right.
So if we'll able to give the girls and boys, and if the cost is like 200 to 400, then it can be included in the government immunization program very easily. And if not, then especially the even the lower middle class and the middle class people can get this injection to their children, so that at least they are prevented. And this vaccination will it will be the game changer, because it doesn't only protect that person who gets this vaccination. It produces kind of herd immunity, that when we vaccinate the child for these viruses, so these viruses will become less in the population. So that is why their transmission also become less, and that is why it produces the herd immunity, which is very helpful. That is why this lower cost Indian indigenous vaccine will definitely be the game changer.
How much do you think has the affordability aspect contributed to the leading number of cases? Because at present we are dependent on foreign manufacturers for these kind of vaccines, which go up to about 4,000 rupees. Clearly, something that most Indian families will not be able to afford. The kind of trust that it is something that you must do is not coming in from the medical fraternity as well. So a lot of the times women and girls skip this vaccine. Even if it is available in the market, it's because it's priced at 4,000 rupees, they choose to skip. And has that also contributed significantly?
Definitely. Even I'll tell you that my son is at present is in 10th class. So he's 15 now. So I have given him the vaccines, this HPV vaccine, and I have given like nanovalent vaccine. This cost is 10,000. So my son's friend's mother, because of some problem, went to the doctor, and that doctor advised her a vaccination, this cervical vaccine for her daughter. So she asked me, doctor, this vaccine cost around, jo lower most, that is the bivalent, the quadrivalent, that is of 4,000, and that is nanovalent is of 10,000. Should I get it? Because it is so important to give it, because 10,000 to मेरे बच्चे की month की fees है. So that is a very, very big issue. If this cost will lower down to 200 to 400, and we will create the awareness that even the lower middle class can afford this vaccine and get these injections to their children, which will be very, very helpful. So definitely it will be a
certainly,
game
and in a country where Dr. Sharma, the fact that women do not even consult or go for routine medical checkup when they're expecting, so they do not go to the gynecologist, because perhaps if they're living in villages, they go to the Anganwadi centers, get the medicines, get the checkup done, and they do not go to the specialized doctors, specialized clinics. So perhaps all of this awareness that we are talking about, the effective communication that needs to flow down to the lowest level, is not happening. So in order to make this program a success, once this vaccination enters the public immunization program, we have to make it effective. We have to make everyone aware, including the lower middle class, which can then afford it. What should be the way forward?
You read my mind. Actually, we started when I was advisor Cancer Control Delhi government. We started one school cancer education program, and the book Cancer ki Kahani jo hai bachchon ko sunani was very famous. 5th, 6th edition. And the purpose of that book was that the book was given to the child, it reached straight away into the bedroom of his parents. So we have to start the awareness at that level. I'll give you must have seen some of the posters. We were doing regular vaccination at Delhi State Cancer Institute of the school girls. Every day 20, 30, 40 girls will come, and these all that expensive. Because at that point of time, Delhi government had a thought of giving these vaccines to the children. So we were giving these vaccines every day. Abhi temporarily for few months it is stopped because the cost of that vaccine was very high, and it was costing on the exchequer. So we are waiting for this vaccine to come. The more important thing is the school health is very important. Awareness, we are a factory of producing children and population. So the antenatal and postnatal clinics where this information should be available, you must be seeing these posters we are going to put in our hospitals and other places. Recently these posters will be put in Mohalla clinics even, level of Mohalla clinic, primary health center. This is number one. Number two, I have always been insisting on all Lok Sabha and Rajya Sabha programs to declare cancer as a notifiable disease like dengue or infection. Once the disease is declared as a notifiable, it reaches the primary health center level where the doctor sitting there, the Anganwadi worker there, all of them are aware of a word called cancer. The Anganwadi worker and the auxiliary nurse, midwife, A&M or nurse, she knows how to sort of advise the female how to do the pap smear, and then at this district level hospital you can provide colposcope to detect the disease early. I'll give you an example of a study which was carried out in Amblikai in state of Tamil Nadu. Few thousand people were studied. I am coming back to Dr. Kanika's statement again. It has revealed that a female, once in lifetime, if she goes a complete gynecological examination, she is saved at least 80 to 90%, she is saved from cancer. And if she does it for 2 times, she is saved at least 99%. Why? Because when case comes to Dr. Kanika, she examines the patient, she listens to her symptoms and she says, acha, acha, tumhe ye. She will immediately go for a pap smear. She will examine with the speculum and she sees the cervix mein kuch gadbad hai, yahan pe infection hai, inflammation hai, things like that. She will treat that infection.
Right.
Once she treats the infection and then advises her husband also for a precaution, barrier contraception and other things, male hygiene. Male hygiene is very important. Males are not very clean about their private parts, so is the female. Once she advises it, the genesis and the foundation of the cancer cell is uprooted. The cancer cells don't form because she has prevented. So, the complete gynecological examination once in a lifetime or twice in a lifetime, or at least when there are symptoms, will change, and that is where Dr. Kanika will say, oh, you have this, you have got a chances, okay, would you like to have the vaccine? So that group which is not in the children age group yet can be benefited by vaccine at the age of 20 years or whatever years will be benefited.
That's a very significant point that you've raised. So the next big challenge, Dr. Kanika, is going to be, we make the vaccination affordable, but at the same time, we have to make early screening also accessible, affordable. The fact is that people are not aware of the kind of hygiene that they should maintain, especially, and as he said, the kind of awareness that should be expected from a population like ours is missing. And that is the root cause of these problems. So we have to address that root cause, and for that, the information has to be effective, and it should be convincing to the people to actually come to these screening centers, get themselves screened. How are we doing that? And in the times to come, like he said, because this is going to be the most vital aspect, how can we increase accessibility of these screening centers?
So basically, this accessibility of the screening, and secondly, the awareness for the screening should be created like at I should say like at the this vaccination awareness, we can create awareness at the school level in the PTM, in the parent teachers meeting where the parents also come. So if we take some programs or some small talks at that time also, that will definitely help to the, because at that time the parents are very much concerned about their children, about their wards and themselves also, because they want to know how they can improve the future of their child, and that is a very important part of the future of the child. So at that level also the awareness can be created regarding the screening, and people can come to the government hospital. In government hospitals, screening is freely available. So they have to be aware that after achieving the sexual activity, at least at the age of 30 years, 35 years and 40 years, she should have a proper gynecological examination, including the pap smear or the LBC or via villi, which are the screening tests for the cervical cancer. That can be done, and that test are freely available in each and every government hospital. So it can be done very easily, but they just have to come to us.
Clearly, that's a fair point, but Dr. Sharma, at the same time, because we have a very diverse population, there would be children who are not going to schools, so the kind of solution that she provides may not work for them. How do we cover that population?
No, she has already provided the solution. I'll tell you how. We are the world capital of cervical cancer, to tell you the truth. She has already provided the solution, because as I told you, people are coming, the government has promoted and encouraged the hospital delivery. They have talked about hemoglobin and other things. In the hospital delivery, that is the time in antenatal and postnatal clinics where the child is going to be born, and after the birth of the child, that is the time you can do this. This is called opportunistic screening. Some people said that opportunistic screening may not be very successful. But for a country like India, where a ghungat-clad woman will not allow you to be examined unnecessarily, this is the time when we trap the public. to undergo a screening and gynecological examination. That is the time. You see, the point is, the moment you start a screening program, people will run away. I'll cite you a small little example. You do screening camp. It's a very popular phenomenon. Screening camp. People don't go to screening camp. Kahin cancer declare ho gaya. So if the cancer is declared, what will happen? So at least you have this opportunity. I was in an Arab country. There was a WHO recommendation at that point of time that even if a female comes with a tonsillitis or with some other non-gynecological problem, get her gynecological testing done. So, you know, these are very labor-intensive methods.
That's right.
But the opportunity lies with the gynecologist for the opportunistic screening, number one. It lies with the government for proper public awareness and declaring cancer as a notifiable disease so that people at least know the word cancer. And number three, to provide ample amount of vaccines.
You know, that's a very important point, and the fear that he speaks about, what if I get detected with cancer, if I go for screening, and what if something, you know, happens? It's because of the high cost of treatment, something that I know that I will not be able to afford. This vaccination program perhaps is going to take care of that aspect to some extent.
Very true.
The question is, and the challenge that we may face now is how to make this vaccination program a success. So each time there's a new vaccination program, there is bound to be some kind of hesitancy. So now we all have to come together and work towards how to make this effective. What are the kind of roadblocks that you see that the government may have to face, that we together will have to face when it comes to making HPV vaccination program a success in our country?
Basically, with each and every vaccination or each and every immunization, people have a fear of various side effects, mainly.
Clearly.
Side effects, so we have to explain during these awareness programs, during these awareness talks, workshops and all, we have to just make them aware that these vaccinations, these immunizations will not have any major side effects. Only the very minor side effects, which even these side effects can take place with each and every vaccine. Like children are getting DPT vaccine, and they do get fever and soreness and the pain at that site area. Only these are the side effects with these HPV vaccine. So we should be, we make them aware about the side effect, that these side effects are very, very low. So, and doesn't cause any future problems also. They are just to improve our future,
right,
to save our future.
The communication strategy has to be designed in a way that is very, very effective. It spreads awareness, at the same time convinces the people to come forward and get vaccinated. Perhaps that should be the best way forward. That is something that the government is working towards. And when this Cervavac is, you know, pulled in and brought into this immunization program, we all hope that the kind of hesitancy that we have seen in the past will not be reflected once again. So with that hope, I'll have to wind up the program. Thank you once again, Dr. Sharma, Dr. Kanika, for joining us on this edition of Healthy India.
One thing is that the one suggestion is that during PTMs, these awareness about the vaccination can be given, and especially this vaccination is mainly effective up to 9 to 14 years. That is the best time because it creates the most of maximum immunogenicity in the body. After that, because like sir said, ki with the adolescent, their sexual activity has grown up.
This is the information that has to be thrust upon people, and you know they have to be made aware that this is the perfect age group. This is the clear right time to go and get vaccinated, you know, in order to keep one safe and prevent cervical cancer.
I have to say something for you.
Time is running out.
That your role is equally important, where there should be more health programs and repeated programs. We have got a national cancer calendar on the dates of international and national cancer days. Please take that calendar from me. Unless and until you do these programs more repeatedly, like sports programs, stock market and politics, this will help a great deal.
As public broadcaster, we do keep that in mind, and we will, of course, do follow-up programs on that as well, because for the larger good of our country, it's important that we bring down the number of cervical cancer cases in our country. It affects Indian women, and it's time that this has to be addressed at the earliest. So that having been said, I'll have to wind up the program. I would like to thank both doctors for joining us on this edition of Healthy India, sharing your thoughts, your views, and your suggestions with us and our viewers. And with that, I'll have to wrap up the program. Thank you very much, viewers, to you as well for your time. I'll see you same time next week. Take good care of yourselves. Keep watching Sansad TV.